people engage in primary care, they're healthier, right? And I feel like I'm preaching to the choir here, but getting people to engage in their health early and often is the way to get better outcomes for our employees, to catch things early so that those conditions, those emerging conditions, don't become catastrophic conditions. But I think for those of us who work in healthcare, the other thing we know is that getting employees to use their benefits is really hard. We know that people that are on lower salaries don't engage in preventive care nearly as often. They use the ER as their preventive care, right? We also know that that light in the tunnel in terms of primary care, that's an oncoming train of shortages that is going to be hitting the country and is already starting to hit. So, what we're here to talk about today is what are the solves for some of these things? With me today, I'm really excited that we have 4 individuals who are working in this space to improve access and the user experience, and hopefully get these reluctant users to become frequent flyers of preventive and primary care. So with me, I have Mike from Joya, and this is one of the first employer benefits dedicated to primary preventive skin care, where they combine skin cancer screenings with wellness and aesthetics. And I have Max from Superpower, which is a new system of personalized health with 100 plus kind of biomarker lab testings, where then they help create a personalized plan for that individual to stay on top of and improve their health. I have Molly from Headway, who makes in-network quality mental health actually accessible with over 75,000 providers, one of the largest in-network behavioral health networks in the US. And then I have Scott from One Medical, that is now part of Amazon Health, but I mean, that's primary care redesigned around access and prevention. So thank you guys for joining me today. I think we'll jump right into it. One of the things when we talk preventive care tends to be a long-term game where you're looking at outcomes 3 to 5 years out, but employers are budgeting in 12-month cycles. So how do you guys make the case for investing now in something whose payoff might be a few years out? How are you bridging that gap? Do you want to start? We'll start on the far end with you.
Sure. It's great to be here. Thanks for having me. Primary care is a very broken industry. We talked about patients not being able to have accessibility or even get to see. I mean, have you experienced being able to get an appointment at primary care? It's very difficult, right? And certainly if you have to wait a number of weeks, or you have to come back, or you have to be referred out in order to get care, it's no surprise that individuals are going to urgent care or going to the ER, and those are really costly forms of care. But we look at ROI, the tenures are getting shorter for employees. The payback to justify an ROI is definitely difficult to justify that. And so you have to be able to pick off some of the low-lying fruit in order to justify that investment. And so one of the ways to do that is by changing primary care, making it something different that really is hinged on access, comprehensive care, and customer service, creating a raving fan, if you will, in the space of primary care. And then you'll get not only engagement, but you'll get re-engagement. The word patient really bothers me, because I think it means what it says, is that we've all had to become patient in primary care. Patient to wait, patient to get an appointment, patience for your paperwork, patient sitting in a waiting room, if you're lucky enough to get in to see someone, only to find out they only had a few minutes to spend with you. And so I'd like to see that shift towards a customer. A patient is just a customer, and that customer deserves to be treated in a way that they never want to experience healthcare any other way again.
How about for the rest of you?
What I really want to know is, how did you get Superpower domain name? But maybe I'll jump in from a skin perspective. So everything I'm going to share is focused on your largest organ, which is skin. We fundamentally believe that healthcare is a stick and carrot type of environment, and we know that that's the case, and we believe that it should be a carrot and avoid the stick type of environment. So if you look at your skin, where do most people engage when it comes to skin? It's predominantly in the aesthetic market, facials and peels and Botox, and that's a lot of my background. There are 30,000 med spas in America. There's 12,000 Starbuckses, right? So just to give you context. So the access is not the problem, right? It's what you do with that access. So if you look at a very accessible network of providers that are run by nurses and dermatologists and so on and so forth, and then you look at the rate of skin cancer going through the roof, and you kind of sit back and wonder, like, why is that? And the driver there is limited dermatologists, high deductible healthcare plans. Nearly a third of us in this room will have skin cancer. It's not an if, it's a when, right? But how often are you calling a dermatologist to get an appointment? And if you do, it's a good 6 months to see one. So then we looked at the carrot side of the equation and we said, well, if everyone, meaning 6, 7, 8, 9 million consumers are walking in to get a facial, why can't you get your skin cancer checked out there? So that is the driver of us trying to catch things early, because you're already in that environment every single day. And if you catch that, or if you get that skin cancer check done, we then reward you, so it's a carrot on top of a carrot. We then reward you with a whole bunch of subsidies toward things you are in there for, like facials and Botox and so on and so forth. So I don't believe you should wait 3 to 5 years to have any payback on any type of investment, because you wouldn't do that personally, so why should an employer?
Well, and with cancer specifically, like catching it early for the employer is something that,
It's everything.
exactly,
Right.
exactly.
Yesterday, we have this user feedback channel in Slack, and we had something really moving come through. Someone said, thanks to Superpower, I discovered cancer. And we discovered that through a single biomarker of the panel of 100 that just about every doctor I've come across doesn't test. Right? And that person now is going to change their life, which is really moving and really powerful. And what we see is that there are many biomarkers that are not commonly tested that are actually quite low cost. And when you empower someone with that information and with the interpretation to see what they mean, people start being able to be in control of their health and start taking actions to improve their health. So we, even expanding into B2B, we started direct-to-consumer, did an actuarial study on 3 of the 100 biomarkers we do. And just on those 3, there was 1.5x ROI. That's 3 of 100, right? And I think part of this is that there are many things out there that people aren't testing or aren't aware of. And even if they could test, the catch is, how do you get someone wanting to and wanting to engage and then wanting to actually interpret that information to take action? So we'll do that, right? For example, we'll test A1C. It's a very common biomarker. That one's for diabetes and pre-diabetes. The catch is when you call that A1C and you're in a doctor's clinic, it doesn't mean anything for the person. So the question is, how do we create an experience around information that exists in someone's body to get them to care and to get them to engage? And when that happens, you start to see outcomes. And that is not, to your point, in 3 to 5 years. That is this year. That is today, right?
Yeah, and on the behavioral health side, I think there's a real instinct to try to say, oh, if you get preventive behavioral health services, it'll save you on the medical side years down the road, right? And there's been a lot of great studies, like Evernorth and Cigna have put a study out, like $75 PMPM over 27 months. There's savings, there's proven savings, but I think that's challenging because people don't stay with their employer for that long oftentimes, and you really do need to see the impact of the investments that you're making. The good news, or I guess like upside of investing in behavioral health, is that if you've worked with employees, you can see if you offer the benefit, if you have the solutions, you will see the impact within months, not even 12 months sometimes. Presenteeism, absenteeism is a huge problem, and so having that solution available and accessible to your employees or to members is a huge thing. And so you can think about it in terms of the showing up to work, showing up as a productive employee, showing up and being effective in the workplace is a huge thing, but also there's in-year opportunity to show ROI on the behavioral health service line specifically, right? If you're getting preventive outpatient services, you are more likely not to show up in the ED. You're more likely not to show up in the inpatient setting. There's higher levels of care that people often default into when they're not able to find that right therapeutic alliance or that right therapeutic match in the outpatient setting. And that's really where Headway comes in. We have the largest network of mental health practitioners in the country. There is someone for everyone in most cases. They're in person, they're virtual, and you're able to book within 48 hours, you're able to really find someone that meets your needs. And so offering that preventive solution, it has that near-term impact on savings, which you want to see if people are not showing up for $30,000 visits in the inpatient setting, but also just in terms of showing up to the workplace in an effective way. So the behavioral health ROI story is sometimes a little bit easier to tell to some degree, especially because the stigma has gone down. But it's important to know that you should look at the medical side, but also behavioral health specific ROI.
Well, and following on from that, so you're talking about one of the data points for behavioral health specifically, but it applies other places as well, is the avoided ER, the avoided surgery. But that doesn't show up in the data because it didn't happen. So would love to hear from each of you. So when you're talking about metrics or proxies where you're trying to show progress, where you're trying to show, hey, we did catch it at a stage 1 versus a stage 4, or hey, this person didn't go into the ER when chances are they would have. How are you thinking about doing that to show that value, that near-term value?
I could jump in. For us, it's simple. We will catch 1 case of skin cancer with every 200 people that just walk in to go and get their facial. So very simple math. Because it is prominent, it is visible. I'll give you the best analogy, which is 20 years ago, optometrists never diagnosed glaucoma. But yet they opened up your iris by putting and dilating drop. And when the laws changed and allowed an optometrist to look at the back of the eye, all of a sudden you were able to catch early signs of glaucoma. So I spent a decade in eye care and was part of that. The same thing will happen here. When we get an average med spa that you can walk across the street to go in and get your facial, to say, hey, before you get this, I need to do your skin cancer check, which is not that hard to do. For every 200 we screen, we'll catch 1 case. So the metrics are very, very binary.
Yeah.
A similar story where there are a handful of, let's call them biomarkers, we know that are predictive of some sort of event. Right? And we understand the link. If we see someone with, let's say, A1C of 6.2, that's not diabetes yet, but we understand the curve over which that becomes diabetes. If we see CRP of 18, as we saw with as we see in incidences of cancer, that might not be stage 4 cancer yet, but that's very high inflammation in the body, which is associated with all sorts of problems. So we start being able to do the math around some of those things. The other thing that I think is going to be particularly interesting over time, look, we're early, we're a couple years into this, but now that we're working with all sorts of different employer groups, it's going to be really interesting to see the claims of the members who use Superpower versus the members or patients, we call them members, employees who don't use Superpower. And my sense is we're going to see quite a large delta, partially because of what happens when you get someone caring about their health. Right? A big part of it is just get someone to care. Right? You probably haven't really heard of a company in health called Superpower because it's very non-health. But if you're an employee, if you're an individual, you're not thinking, oh, I want my random health company that feels esoteric. You're thinking, I want something that I can relate to. I want something that speaks to me in language I understand, not as a bunch of random numbers, but as something that kind of makes sense. Right? We started consumer, and that was a very intentional decision, because when you start consumer, you're forced to build something people want. You're forced to actually grapple with, how does the average person think? What does human psychology look like? Because that's how you get someone engaged. Our members come back to us really often. They chat with the AI, they sometimes message their care team, they upload data, they engage with us. And that's unusual in health because everything used to start with building a health tool rather than building something for the person who we want to engage and care.
So I think behavioral health is kind of the opposite of the blood test example. There's not a blood test to say if you're getting better from anxiety or depression. It's way more complex than that, and it's way more nuanced than that. And that makes it actually quite challenging in a lot of conversations to say, hey, this is really showing you exactly what's going on. And that's a problem in behavioral health broadly. There's a lack of measurement. That's one thing that we're really focused on is demonstrating outcomes and using those early signs and early measurement to say down the line, you would expect to have fewer higher level of care events or fewer costly events because you're investing up front and there's some strong signal there. So we look at third visit retention in care, which is a really strong indicator of therapeutic alliance, which leads to better outcomes for members. We look at patient-reported outcome measures, which is Not something that every behavioral health clinician does. That's a big focus for us to ensure that we're able to actually measure someone getting better over time so we can give that information back to employers and say, hey, you're making this investment in your behavioral health network. Here's the outcomes you're actually seeing for your members. Like, that's a good investment. That data has not been historically available before groups like Headway have been able to collect and measure it at scale. 75,000 clinicians. We're doing millions and millions of appointments every year. There's some really strong data there. And then we also look at patient satisfaction. I think to Max's point, like if you have behavioral health sitting outside of your overall benefit, that's not how people think about their health care. They're not like, oh, hey, I'm going to wake up in the morning and I think I'll go to my employer for behavioral health. Like, that's just not how we operate as humans. We feel something, we look online, or we go to maybe our health plan directory. Maybe we go to our employer, but it's important to show up really in a lot of places for employees and members for us trying to find care. And so we look at satisfaction, right? And that's satisfaction in the experience of getting into Headway. It's also satisfaction with the type of care you're getting, with the clinician that we're matching you with. And so matching into care is a big thing that we look at as well, again, because it does have a ties to clinical outcomes. So yeah, that's what we look at up front.
Yeah, we focus on client satisfaction as well, customer satisfaction. It's really important. We track Net Promoter Score, which a lot of companies do, but we've had a 90 Net Promoter Score in healthcare for the last 15 years running. That's really hard to do because, especially in healthcare. But we are a high-tech, high-touch organization. Healthcare is high-tech now. And it remains high touch because somewhere along the line there's that patient at the end of the journey, and so you have to trust that you have a provider that's very comprehensive and knows your individual needs and wants in order for you to re-engage. So, for example, in behavioral health, we're not all think behavioral health. But if we can do a better assessment, look at medication adherence, know you as an individual, understand that trial and error costs a tremendous amount of money in behavioral health. And so it's our job to close that gap and make sure that when we navigate, because your primary care provider should be the most important person in your healthcare journey, that's the way it was intended to be, and that is the person that should have the most overall knowledge until that time where they need to specialize or refer you out to a different solution to get additional care. And so we want that relationship to be built, whether you are interested in a holistic lifestyle approach or really whatever's important to you is most important to us. But you can't do that, again, unless you have a full 30 minutes with your provider. You get in right away, immediately. You have a great experience. Your labs are on site. There's no paperwork. And we use the data to nudge you in the right direction based on your personal metrics and data.
Love it. Okay, so last question, just because we're coming to the end of the session. So we have some newer entrants. We have some more, I would call it more classical, whether it's behavioral health or primary care. Like, these are just more in the lexicon. But each of you still encounter groups that are like, not sure this is something that I want to, think about or that my company is ready for. So, how do you respond to groups that are like, nah, this isn't right for me, not right now, maybe never. So maybe Max, starting with you. And
so I think the kind of table stakes starting point is we need to be at least cost neutral or at least save a little bit of money, right? And that's where we'll start. And we will show that, and we have the data that is showing that. From there, the interesting thing is, if I'm putting myself in the shoes of what a benefits director, a CHRO wants for the company, like what's the story they want to tell? How do they want to choose how they configure a benefits plan? And one option, and this is what happens today, that's great, the way kind of healthcare looks today is you have insurance. And insurance will cost maybe $5,000 to $20,000. It's a lot of money. It costs a lot. And if you think of an employee kind of like they care about it, but it's not the thing they're thinking about and loving the employer for. Superpower comes in and we say where $200 a year can be as low as $100 a year. Our early groups, we're seeing 40% utilization in 30 to 60 days. So most of most of the companies going to use it, because we've built something that is social, that's engaging, that employees talk about. Members share their health score, their biological age. Health becomes something that is interesting and engaging. Of those members who sign up, we ask them, after we give them an action plan, we say to them, what was this action plan like? How does it compare to your doctor? And 1 in 3 say it changed their life. There are very, very, very few benefits that you can give someone where a large chunk of the organization signs up, and 1 in 3 will say it changed their life, and 93% say it was better than their doctor. And this sounds crazy, but the bar's very low. We've always been trying to solve health in a reasonably tech-backwards way. And our basic statement was, what if we actually build a product that feels more like you're using Apple or Tesla and is engaging and brings that to life? We build a brand and community and kind of social experience that feels more like, I don't know, Nike or something people love, right? Rather than just another benefit. And we start to see this come to life within the enterprise. And then the final thing is, how do we make it just really simple for someone to get up and running, right? Like, no one wants to have to integrate over multiple months. We can be live within 5 days. We can be live faster. When we're being live faster with some groups, we try to make that really simple as well to make the decision within the enterprise easier.
And Scott, maybe we'll jump to you. And
Sure. I would just say that HR executives sometimes look at us as just another benefit rather than being foundational. So along those same lines, it's so important when something is foundational to incentivize that behavior or that engagement. And we're not an insurance company. We're agnostic, to the carrier. So, your patients, whether they come to us individually, whether you migrate to a different type of plan, whether you get involved with an individual contribution plan like the ICHRAs that were mentioned earlier, or you have a population of 1099 individuals that wish they had a benefit, that's a population that we can serve and really serve well. And so just have to look at us in a different light at Amazon One Medical.
yeah. And how about you, Molly? I mean, I feel like you're in network, so it's kind of an easier yes, right?
Yeah, I mean, you'd be kind of surprised. It's more around, and what I would say to benefits leaders, and I was telling someone this earlier, like my twin sister is a benefits leader. She's head of HR at a company, and I'm always speaking with her about this, but I would really encourage benefits leaders to look at their behavioral health offering. Look at everything you have, right? Like, you might actually not know that a group like Headway is in network. It's at the cost share that your employees have as part of their benefit. You don't need to pay anything extra. There's no implementation. We can make you a landing page if you'd like. And so you probably already have like a very rich benefit, to be honest, and you might not need to be managing multiple other benefits that actually carve out behavioral health, right? So think about behavioral health. How can it be part of your overall medical offering? How can it be part of whole person care? And then my favorite thing to talk about, which we didn't speak about as much, is benefit design. So I would also encourage people to look at their benefit design. If you really want behavioral health to be a preventive service, if you want to encourage the right amount of utilization for members, look at cost share. It's the #1 indicator of how much care people actually get. We've run a large study within Headway of over 700,000 member claims, and what we found is that cost share and cost of service is the #1 driver of whether or not someone actually gets the right amount of care for themselves. And so if you are thinking about your benefits holistically, I would look at what you have in network, look at your cost share and benefit design, and then really think deeply about what you want your employees to experience when finding care. And talk to your carriers or NAVA if you're interested in learning more about that.
And Mike, take us home.
Yeah, so we just simply say 3 things. Number 1, we are a no-cost option to employer. It's purely a voluntary benefit. We do have a subsidized option, but we are a no-cost to employer. Number 2, we're one of one. I don't know how you all keep these point solutions in mind. I thank God for NAVA, but I can't even keep 2 in mind. But we're one of one, so we're the only one focused on skin. And then lastly, as a voluntary benefit, we're averaging about 15 to 20% conversion with nearly 40% utilization. So if you just put us on the shelf, we'll likely save you money. That's it.
That's awesome. All right. Thank you guys so much. Appreciate it.
Thank you.
Thank you.
Thanks, everyone. Maybe before you guys totally leave the stage, we have a few minutes to maybe field some questions from the audience.
Oh, if I had known that, I would have kept going. Listen, it was giving me the red light. I was
Sarah
like,
is staying
I
on
gotta
task.
go.
I love it. But yeah, we do have a few minutes. I don't know, Sarah, if you had an extra question that you wanted to dive into.
Well, let's see first. Do we
Or-
have questions? Do we have questions in the group? And if not, I have some extras that I can seed. No? Okay.
All
So
right.
I'd actually love, so Molly, you were talking about plan design. I'd like to hear from other people. You know, are you, like, so we talk employer sponsored, voluntary, employee paid, which sometimes actually can mean that they will engage more because they paid for it up front, so they know about it. Incentivization, like for the rest of you, what are some of those tools where you actually see that it is changing how employees are engaging and is actually moving the needle? You know, I'm curious in each of your spaces.
I think the more that something is foundational, the more it should lean towards the employer-funded or shared side. So the more important it is, obviously, the more you should head in that direction. So first and foremost, that's it. There's other ways to come at primary care that can make it more accessible, like DPC or a capitated rate that really begins with someone's engagement as a good way to allow access, as much access as someone needs for a fixed fee per month. And that's a great way to kind of be more equitable in the approach.
Yeah.
So ours is, cost share, as I was saying, is a big thing to focus on. I think also the navigation aspect, our big focus is having the experience of finding a mental health clinician, which is a really personal experience and also is an indicator of your outcome if you're finding the right care. Have it be as consumer grade as possible, right? Like our matching experience is wonderful. We take a lot of inspiration from companies like Amazon, right? How can you make it like every other aspect of your life is one-click checkout, one-click booking. You get customized solutions or customized ads surfaced to you. Headway, we're going to find you the right provider based on what you're telling us at intake. And I think designing programs that feel like the rest of someone's life is probably a good place to start as well.
Awesome. And then Max, do you guys have like versions where it's cost share versus fully employee funded?
Yeah, we'll do employee funded, sponsored, and then voluntary as well. My basic observation is that when someone uses the product, they love the product, right? And we see this. Our word of mouth growth is exponential. It's the main way we grow. So whilst we like it sponsored, as does everyone, we are also happy with voluntary because when employees use it, they love it, and they share it with everyone else in the company, and they talk about it. And our belief is even if we start there in year one, in year two, then we can have those conversations around what does PEPM look like, etc. So that's really how we think about things.
Well, and I do think it's interesting because one of the things that we've seen, you know, we are one of those employers that has a lot of ecosystem partners, right? And so many of them are embedded within our medical plan. If you get medical, you get access to all of these. But because they get it automatically and it's not something that they're having to tick during open enrollment, it's not staying top of mind, right? So I do think there's an interesting balance where you can say you have to opt into this and maybe pay a minimal fee, but now you're going to be that much more aware of it because you had to take an action, you had to tick it, versus it's just one of all of the suite that then is not getting raised to you outside of open enrollment. So I think that's been an interesting conversation I've been hearing on the employer side a little bit more, is as a way of driving awareness of some of these amazing
We've actually
benefits.
developed a product around that called the Health Benefits Connector. So when you're interested in a benefit, many times you're not familiar with everything that's available to you for that same reason. So we're trying to serve that up to the patients in a
Well, for you
more
guys, the
consumable way.
providers, right? Because no one listens
we're the
to
providers, but many times there's other benefits.
Yep.
And we want to make sure that there's access to those additional benefits for that employee. And then the second to that is just we haven't mentioned like virtual care and things like that. So that's a way for folks that can't access every benefit to make sure that there's something that's meaningful for them. Yeah. There's a lot of healthcare deserts that still exist out here. And so we're trying to solve those through technology and making sure that if it's an at-home experience, it's as close to being the same as in person as possible.
Love it. All right. Okay, now for realsies this time. Now we're done. Thank you guys so much. Appreciate
Thank you so
it.
much.